yesterday I had mentioned when we did our availability, had launched the Memorial Healthcare drive-through testing site with in conjunction with the Florida National Guard and Memorial Healthcare, and they had done, I think, over 400 samples taken by the time I did the press conference. We had anticipated that they would do about 250 a day. They were able to do that by the time my press conference. Happy to report that yesterday in total they took 745 samples that are now being processed, with the results hopefully forthcoming as soon as possible. So I want to thank Memorial Healthcare. I want to thank the Florida National Guard for all their hard work in terms of getting that site up and running, but also getting it running in a smooth fashion. Today, as of 3 p.m., the site's already done another 450. And obviously they're going to still be open for a little while longer than that. We've also been able, HHS sent us another 5,000 collection kits, so we're sending those down to Broward as well. So I think that site hopefully can be a model with what else can be done. And again, that's in Pembroke Pines. It's open 9 to 5, although yesterday pretty much every car in line, they worked really late and did a really good job. And that site hopefully can be a model with what else can be done. And again, that's in Pembroke Pines. It's open 9 to 5, although yesterday pretty much every car in line, they worked really late and did a really good job. And we think that these sites are very, very important. You have seen increases in the number of people that have tested positive, which we expected. But it's important to kind of get a sense of what's out there. It's very divergent across the state in different communities. And, we want to have widely available testing as soon as we can. If we had another 250,000 collection swabs like we ordered immediately upon the emergency, we would be in really good shape. But we're working every day telling Jared, figure out this way. And so we're getting them in and pushing them out. We also have federally supported test sites. So Jared worked with FEMA to be able to get, it's basically a plug and play. They don't give us any personnel, but they give you the different things that you need to be able to take the samples. And so those are going to be in Miami at the Hard Rock Stadium parking lot. They're going to be in Orlando at the Orange County Convention Center, and then in Jacksonville, it's at the Jacksonville Jaguar Stadium. The Jacksonville one opened today. I was able to talk with the sheriff in Duval. Very smooth, actually relatively lightly trafficked. He thinks that they may end up expanding the ages to try to get more people in, and so in some ways, it may be a good sign that maybe not a lot of people are experiencing some of these symptoms in Northeast Florida, but we'll have to see. But that, I think, is every one of those test sites comes with 2,500 collection samples. And so if the collection samples are taken appropriately, that's another 2,500 tests that can be done, and that's going to be very, very important. The Miami-Dade site is due at Hard Rock Stadium on Monday. When we had the Super Bowl there, I don't think people necessarily thought that we'd be back for the testing, but we're rolling with it and working as hard as we can to get as many people, particularly in the South Florida areas that are affected. You pretty much have, I think, Broward, Dade, and Palm Beach, almost 50% of the cases in Florida are in those areas. So the Miami site will have our Division of Emergency Management. The Guard will be supporting the local health department, the Dade County, Miami-Dade Fire Department. You're going to have police. I know the mayor, Mayor Suarez, has been involved. I know Mayor Jimenez, we're working with him on trying to expand as much testing as we can in Miami-Dade. And then the Orange County site is set to open on Wednesday at the Orange County Convention Center. And again, the Guard is supporting that. You have the Sheriff's Office in Orange County. We also have some of the nurses are being surged there. So we're excited about that. Hope to be able to announce that Monday I'll be at the Villages to help open their drive-through test site at the Villages, which we look forward to do. So if you look at kind of where everybody was just 4 weeks ago, if somebody had symptoms and they were tested, they would go to the county health department, there'd be a sample taken. It would have to be sent to the CDC in Atlanta. It would take 5 to 7 days to be able to get that results back. And then we'd have to do everything through there. And it was difficult. We had anticipated getting more resources for that. But once it was clear that may not happen, Jared started getting stuff. Everyone was working hard to do it. And so now we're at the place where I think yesterday, what was there, 8,000 tests just yesterday? Is that the right in Florida?
As of last week.
Yeah. So the scale is going up, and I think we're going to continue to do it. I mean, we have thousands of additional swabs going to places all across the state, Jacksonville, Orlando, City of Tampa. They're working with Raymond James Stadium to do something there. We're sending a lot to the key health departments like Miami-Dade, another 1,200 collection samples there, as well as places throughout the state of Florida. So this is important, and the goal would be to be able to cast as broad a net with this as possible. And I think if you're able to do that, really helps inform how we're best able to prevent more damage from the virus. And I think that that's a very good thing. And then we're also looking at, you hear different things about this company's coming up with this test and this test. Anytime something like that happens, Jared's on it. We're trying to get that. There's one that the FDA approved that would be like almost an instant test within an hour. But there's going to be obviously a huge crush of demand for that, and the federal government's probably going to be one of the major players in that. But we're looking for all of that, and really want to do as best we can. I would say the one thing we've seen with the statistics is, there's a lot said about kind of the 65 and older population, and for good reason. The virus, the fatalities, and the really serious hospitalizations have typically been people who have been over 60 and have a serious underlying medical condition, and that's still being borne out. But I would say in terms of the infection numbers, you actually have a majority of the infected have been under 60. And so that's just something people think, just because you saw folks who were older and who had underlying conditions, thinking like, well, it's really just about people who are elderly. No, I mean, you can get this if you're in your 30s, 40s, and there's not necessarily high rates of fatalities with that, but some people have really had some serious health consequences as a result of it. And so it's just something people need to understand, that it is out. The elderly are obviously are most vulnerable to this, but it's something that could affect anybody. One of the things that people are concerned about as the virus has gotten into the United States and spread in various communities is, what does that mean to hospital capacity if you ended up seeing a flood of patients? Obviously, you see New York, they're having to do a lot of things to try to figure out how to accommodate a really what potentially can be a huge crush with the way that's escalating in the city. We in the state of Florida have 18,000 available beds out of about 55,000 beds overall. ICU bed capacity, almost 1,700 out of about 5,600 adult hospital ICU beds available. But what I've asked Jared, Mary, Dr. Rivkees to do is identify other facilities that could be used. And not just some of these are medical facilities that we could use. Some of them are things like convention centers. We've had hotel owners say, if you want to use the hotel, you can do it. And the reason why you would want to do that is if somebody comes in, tests positive, if you send them back home, they're likely to infect the people that they come in close contact with in their home. So then the virus continues to spread. If they have a place to self-isolate where they're not going to be in close contact with anybody, then the virus dies with them. And so we're working on ways to figure out that. I've told Mary, license any of these places where you may do some of the medical care, and make sure that folks understand that you may need to move people around in a way so that the core hospital isn't overwhelmed. And we have right now throughout the state, 34 hospitals that have 50% or greater capacity. AHCA has identified 6 vacant medical facilities throughout the state, which we may be able to utilize for response efforts, and they're looking at the best ways, to do that. So there's going to require a lot of communication. It's got to have federal communication, local, as well as looking at private sector, but it's something that we've been working on for quite some time now. An update on the Broward ALF, Altria, Willowwood. Remember, this is the ALF where we had the first nursing assisted living fatality. This was a facility that did not impose the requirements that our AHCA put in and that the CMS later issued on behalf of the federal government to guard access to these, make sure who's going in is being screened. They had sick construction workers, sick hospital staff. They had sick people in the food service. So you ended up having, at this time, there's been 3 confirmed deaths at that same facility, 10 total positive cases, and there's 4 more tests pending. We stressed from the very beginning, when this virus was not even something that people were talking about, it was pretty clear from the other countries' experiences that we had to protect the senior citizens in our nursing homes and assisted living facilities. It's why we issued those guidelines early. It's why CMS has done it. People need to follow this because if you're not, you're putting people that you're supposed to care for at risk. Law enforcement is now on site there. CDC does have an infection control specialist embedded on site, and AHCA has somebody there 24/7. And obviously we want to help as best we could. But if you're in this business to take care of people who may be susceptible to this, you shouldn't need to have someone breathing down your neck. You should do the right thing and protect the folks in Florida who are most vulnerable. Latest on cases, we've had a total of 12 fatalities for Florida residents, 720 total new cases, 664 of those are Floridians. Broward is 162 total, Miami-Dade 156 total. We have pending test results about 991, but I think I've mentioned in the past, you have all these private labs that are now processing the tests. And so there are way more than 991 outstanding right now. They don't always tell us. They have to report the positives. We think they're reporting the negatives too. But we're not necessarily sure what's out there until they report it to the Department of Health. And as I mentioned, the age breakdown, 60% of those who've been infected are under the age of 60. Let me just say something about the big picture. Anytime you have, some of these things, whether it's a hurricane, whether it's other major events, and obviously this one would be that and then some, you see all this stuff circulating on, and I don't do social media or text messages anymore, but you see all this stuff. People are asking all these questions about all kind of these, really, really far out things. And I would just tell everyone, just keep cool and calm down. There's no need to panic about this. You just need to take the proper precautions and take the proper steps to protect yourself. At the end of the day, if you follow the basic rules that the CDC has recommended, such as maintaining good hygiene, washing your hands religiously, and maintaining proper social distance from people, you are going to be okay if you follow those guidelines. And you're the really, individual Floridians are the best people who can really help us get past this and successfully past it. And remember, this is something, it's a contagious viral infection, but it's not something like the measles, where if you had an unvaccinated population, someone walks through the room, just by being around, you could potentially breathe in and get the measles. This is something that is passed along from person-to-person contact. Most of the infections are going to be from that. It's passed on when you have respiratory droplets, when somebody coughs or sneezes, and if you're in close contact with somebody within 6 feet, particularly for a sustained period of time, you have, you're then in the zone where you could attract this. Now, you can get it by touching a surface or object that has the virus on it than touching your face, but that's not the main way. The main way is close contact with somebody who is infected. And so that's why things like social distancing are so important, because if you do that, you will be protecting yourself. And the vast majority of the people in the investigations that have been done by the Florida Department of Health, either been people who acquired it internationally and brought it here, or got it with close, sustained contact with somebody else who's had COVID-19. And so it is a contagious infection, but at the same time, it's something that with proper steps you can guard yourself against. And also say this is something that, from a medical and health perspective, it's clearly a huge issue. And I know you got doctors, nurses, all these healthcare professionals working round the clock. Just know that we here at the state of Florida understand many of the challenges. We've been working tirelessly to get as much personal protective equipment here so that we can distribute as need be, working very hard to get, Jared has acquired additional hospital beds to try to help with those needs. And so that is something that he's doing every single day. One of the reasons we did the executive order to stop the elective surgeries was not that the hospitals are filled up now. They're not. They could be doing this stuff before there's a surge. The problem is using all the personal protective equipment. How much of that is there? The feds are obviously working hard to get more, but there's really been a crush on this, unlike anything we've ever seen. But it's something that's very, very important to medical professionals. I mean, they need to be protected. They're putting themselves on the line, exposing themselves to folks who may be carrying this illness. And, we want to do everything we can to do that. But I do appreciate many of the healthcare providers, particularly those who are doing, quote unquote, non-essential medical care, who are donating some of their PPE to the people on the front lines. Some of the folks in other industries that may have some that are doing that really, really makes a big difference. We also look at the economic effects of this. This is something that we're going to be continues to evaluate as this thing plays out. But suffice it to say, if we were here 2 months ago, unemployment claims in Florida were not something that was very substantial. I mean, you had full employment and then some. Now we're in a situation that some of these industries have really been upended. That's going to cause a lot of people who've worked who worked really hard, maybe to get furloughed, maybe to lose their job, maybe to just be put on hiatus for a while where they don't get the paycheck. So we're very attuned to that. I've been working with Senator Rubio about different suggestions for what they're working on. He's doing a really good job working hard, really keeping in mind kind of our workforce and our small business folks, because really they're the ones that are going to get crunched by this as well. And I'd also say, this is something that affects the social fabric. I know a lot of people have been uneasy, have been very anxious. You're in a situation where a lot of the things you used to do are no longer available. You turn on the TV, there's no sports to watch, there's a lot of live events. It's kind of watch the news. A lot of people are watching this, and it's, of course, 24/7 about the coronavirus. And I would just, urge people just to, take a deep breath, understand that, you can protect yourself against this, understand that people at all levels of the state and federal are working hard to help you. As long as you're following these precautions, you're going to be good. If you feel sick, obviously you need to stay home. If you're somebody who, if you're around and, you go walk your dog, if you're not coming in contact with anyone, you're going to be fine. Make sure you're doing things that are going to be able to help you maintain kind of a good frame of mind. Because I really worry as long as this drags out, the effect that this is going to have on mental health in this state and in the country, because you're really looking at kind of some major changes and upheavals that have happened in just a couple weeks. And so people just need to know that it's going to be fine. Protect yourself. We're going to have to work very hard to get through this, but we will. And don't believe everything you see on social media or on the internet. And we're there for you. So with that, I'm happy to take a couple questions.
Yeah, Governor, there's a company that makes smart thermometers, and their data indicates that there's a dramatic rise in fevers in Florida. It seems to indicate that the situation is more serious than what the testing is showing. How are you evaluating that data?
Do you want to take a look at that? I mean, I'll let the Surgeon General talk about it. I mean, we get data from the emergency rooms to the Department of Health to see increases in cough-related admissions, respiratory-related admissions, and fever-related admissions, I think. So, you've seen it go. I think Broward had started to go up, then went down, then kind of went back up. But I'll let the Surgeon General kind of explain, what data we're looking at.
I mean, the most important data that we're looking at is testing. As the governor mentioned, now more than 8,800 test results are back in, and many more are pending, and that's really what we're looking at present time. As the governor mentioned, we have surveillance systems which are out there. In Broward, we actually saw a spike in individuals present to emergency rooms with fever and cough, but actually that dropped down over the past couple days.
But isn't that too late? I mean, by the time you get to an emergency room,
And we also have, you actually have seen over the last week an increase in the availability of hospital beds throughout the state of Florida. And so, but Scott and his team are tracking that. And and here's the thing though to think about too. Even the people that present with fever, cough, shortness of breath, and then get tested, the overwhelming percentage of them come back negative. And so, we've tested, I mean, particularly for folks who are, in that 65 and plus, I mean, the vast majority are coming back negative.
What is the timeline on getting the two Tampa Bay drive-through testing stations open?
So there's already some doing it. I mean, I've talked to some of the hospital folks in that area. I do. Even the people that present with fever, cough, shortness of breath, and then get tested, the overwhelming percentage of them come back negative. And so, we've tested, I mean, particularly for folks who are, in that 65 and plus, I mean, the vast majority are coming back negative.
What is the timeline on getting the two Tampa Bay drive-through testing stations open?
So there's already some doing it. I mean, I've talked to some of the hospital folks in that area. I think Baycare has done some stuff. So there should be some stuff already. The Raymond James site, we want to support. We're working with Tampa General. I know the city of Tampa is doing a lot on that. I'm not sure on the timeline on that, but if you look, you're starting to see more cases in Hillsborough County. We obviously anticipate because the results are coming from the prior 2 weeks mostly in terms of infections. So we really want to get a good handle on what's going on in Tampa and Orlando in particular. We know obviously South Florida is a challenge now, but we still have the ability to contain some of this in some of these other parts of the state. I mean, you look, it's interesting. Sarasota County, they've tested a lot. I mean, they've really done a good job with testing, and they've had very few infections, even though they've tested a lot. So, but yeah, we want to do it. I've been talking with John Corus at Tampa General. They're working really hard, but we definitely think that would be beneficial.
Governor, you were talking earlier about some of the things that you were considering. I'm curious as to whether or not you've looked at what's happened in New York or California or even China. For instance, China put in clinics where if somebody was in a family got sick, they took them out of the family and they quarantined them somewhere else. You see New York and California.
Yeah, so so we are still like with China. What China started figuring out was, as much as you can believe them, but people would be infected and they'd send them home and they'd infect the people in their house. And so one of the things that can be affected, that's one of the reasons Jared's identifying some of these places, because I think the plan would be if you have somebody that presents but doesn't require hospitalization, you test them, you have them be isolated in a convention center, hotel. Don't go back home with your family, because the people you're most likely to affect are those very close, persistent contacts. Not just walking by someone it's the close contacts. If you're inside sharing a house with somebody, those are obviously the ones. So yeah, we're absolutely considering that. And actually, I mean, hopefully, it doesn't get to that, but we're planning for that for sure, because I think that that's the prudent thing to do. Yes, ma'am.
My question was more upon the fact if you've seen things that other states and their nations are doing that you said no, that didn't work, so let's go in a different direction? That was sort of where I was trying to.
Well, so I would just say, obviously a lot's going on in New York. New York's numbers are off the charts. They have over 10,000 infections. Obviously, they have New York City, which is kind of the perfect place where something like this would spread. Very urban, people always in close contact, public transportation, and there's other things involved in that. So you look at that, but then you also got to see what they're dealing with in their circumstances versus here, and then make the decisions. I would say the big problem with a lot of this stuff is, nobody really has adequate data that they can really say, what's going to happen when you do X or Y. A lot of these are built on assumptions and models, and I respect that. But I know California said that maybe half their state would be infected, and that was an analysis I looked at, and I wasn't sure that was something that I necessarily bought into, because if you look at Italy, I think they have 60 million people. They had, as of like yesterday, I think they had about 40,000 infections. And so there's a lot of this that's really driven by assumption. So you just got to try to get as much information as you can. What are the actual facts? You talk to folks on the ground. You talk to folks. The president's task force has been great. I mean, you call, we've talked Dr. Fauci a number of times, talked to, the U.S. Surgeon General a number of times, VP. They've been really, really good and really, really helpful. Yes.
So I wanted to ask you about Medicaid. I know some Democratic lawmakers have sent you letters about that. I know that you're doing the 2 months where if you're up for recertification, you're delaying that. But what about actually temporarily extending or expanding Medicaid to people who aren't ordinarily eligible for that?
Well, so on this, the testing's free. You're going to be taken care of. I mean, I know, like in a normal situation, this is an emergency situation. So someone presents themselves, at the county health department. We're going to work to take care of them. I'm not sure I can just unilaterally do some of that stuff, anyways. So people are going to be taken care of, and people can know if you have these symptoms. And you talk to a physician, call the county health, whoever you talk to recommends the test. You're not going to have to pay for the test. I mean, you're going to be fine.
Yeah, Governor, you mentioned putting drive-through testing sites in hotels, which is something that China has.
Well, no. So with the hotels, let me be clear. The hotels, I think, would be more for what Gary was mentioning, what China did by self-isolating the people who were suspected of carrying it rather than send them home. I think that would probably be, what we would use a hotel or some of those big areas for.
Is this an idea where people who test positive would go to the hotel, stay at these hotels, or people who have fever?
Or people who have symptoms and we don't know the test result, so you would go there. But yes, I mean, I think we want a place where positive cases can be self-isolated in a way that they're not going to infect other people. And with all this stuff about, we tell people, obviously, use your good judgment about staying away from people, cleanliness. But if you have a household of 5 and you infect the people, people go out, kids go out. All these people will do stuff, and as much as government can say, don't do this, don't do that. I mean, people still do it. So if you just take that out of the equation, then all of a sudden you take somebody, they're having no more contacts for that period until they're not contagious, and then I think it helps you get a handle on it. So we will look at, and really I was surprised that people have said, look, we're not using these things anymore. Obviously, we got to get behind this, get past this. So let's try to make good use of it, and that could be a way to be able to do it. So, but I'll have an update on the Villages plan tomorrow. I think I've mentioned before, it's drive-through testing Villages style, where they're going to be taking their golf carts through to get swabbed as they're going through. And they've really, because obviously their population is more at risk, but it's one of the most active communities in the United States. And so it's interesting how, talking with some folks there, social distancing applied to the Villages. They don't do the indoor events anymore. They don't have any of the gatherings, large gatherings outside anymore. But what they do, the tee sheets are filled on the golf course because they're going out. They have their own cart. They're not allowed to shake hands. They're not allowed to touch the pin, and they just kind of do it and then go. And so it's kind of active life living in an age of social distancing, and I think it's really neat the way they've had it. And I bring that up because whatever we're doing for mitigation to do this, we obviously want to be effective, And in order for it to be effective, it needs to be sustainable. It needs something that the people will buy into and will continue to do it. And so if someone has